Hello and welcome to HIMSScast. It's been quite a year for healthcare systems that have been dealing with the COVID-19 pandemic, the actual treatment of the disease, as well as all of the many changes to technology that have occurred because of the need to social distance and quarantine. Among those, of course, has been the boom in telehealth that we've discussed many times on this call. Bill Siwicki, our features editor at Healthcare IT News, has been working on a feature series talking to hospital folks about lessons learned from the pandemic. So what we're going to do on this show is we're going to recap a little bit of what was said in that article. So I'm going to dive into some questions starting with Bill, but before I do, I just want to thank our sponsor for this show, Zoom. Today's podcast is brought to you by Zoom for Healthcare. Zoom for Healthcare, unified communications that keep you connected and compliant. All right, so Bill, working on this series, what were some of the lessons you heard over and over, or that struck you as the most universal?
Clearly, the one most universal lesson learned was speed. So many CIOs and other health IT leaders were talking speed, speed, speed. Normally, it takes months or even years to get IT projects up and running. But it's amazing how quickly you can do things when you have a deadly global pandemic biting at your heels. The urgency of projects was amazing during the last year and a half. Things like testing documentation, vaccine hotlines. Teams were standing these things up in weeks and sometimes days. So speed was just probably the biggest thing that kept coming up over and over again, that CIOs want to continue applying in the years ahead, that they've learned the lessons that these things can be done much more quickly than they have in the past. You know, it taught CIOs different ways of doing things. It taught the C-suite how to move more swiftly. I was talking for my last article that just came out. I was talking with Scott Richard, who is the CIO of Mercy Technology Services at Mercy, which is a huge health system based in St. Louis. And I just wanted to share a quote from Scott about what he was saying about speed. Quote, "As the pandemic emerged, there were clear objectives on which to focus and agreed upon metrics by which to measure our progress. We've had plenty of successes and accomplishments prior to the pandemic. The focus and agility of the entire leadership structure resulted in faster decisions and alignment between multiple teams focused on the same outcomes. This permeated into our technology response as we developed fast, minimally viable products and fast improvement iterations for digital solutions for testing, home care, follow-up, and eventually vaccination management." And he finished with, "We're still focusing on clinical quality and operational efficiency objectives with similar focus and urgency. The challenge is to maintain that operational agility to solve operational problems quickly, but also keep in mind all of the long-term change the game strategies that we know will be necessary for long-term success." Joe, did you find that you were able to get things done more quickly? I know you said when we talked that you certainly moved quickly with telehealth, where you saw exponential growth.
Absolutely. And those are some of the things that we're able to do based on some of the actions that we took as an organization as well. A great example is that when we started, and I'll give you a couple of quick statistics here, is that originally when this program began, we had about 811 synchronous audiovisual telemedicine visits. In the subsequent months after the adoption, April, we jumped up to, and this is across 60 specialties, we jumped up to about 3,800 telemedicine visits in April, and then 28,000 in May. So if you take a look at that and you look at the exponential speed that you have to go through, that means you put your systems in place, you get your providers aligned with you as well too, while at the same time you're looking at all these procedures that you need to walk through and getting patients engaged along the way. So seeing that, it really jump-started something that took many, many years to go to telemedicine, to really jumping into a high stake, high performance, high service environment. So from my standpoint, I think it escalated in a very big way, very positively as well too. And the pandemic is that's, if I look at one of those silver linings in this, I think we've reached out to a group of patients that we normally wouldn't meet up with before.
And another lesson, Jonah, that kept popping up from CIOs was the new importance of video conferencing with Zoom and Microsoft Teams and such.
Absolutely.
They have really been getting a lot out of this different style of meeting. It's amazing that people normally think, well, you know, if you're face to face, you can see people better, you can read body language, you can do this, that, and the other thing. But what kept coming up over and over was that the Zoom and Teams meetings were much more efficient, were much more productive. Joe, this is a lesson learned that you brought up in the story that we worked on together. Can you talk a little bit about that?
Absolutely. A couple of things that I'd be remiss in saying that, you know, as we were going through in the very beginning, we were going through a Microsoft Teams deployment. And part of that is this put that implementation into hyperdrive. So essentially things we were doing normally in the office, we would get together, we would meet, we shifted gears within a matter of weeks to get folks to work from home, become productive very quickly. And we had to use our telecommunications group, our divisions, and those folks to kind of come together and really deploy those systems and help folks access from home. What happened, the result of this, is we found that people really got to speak more. They talked more quickly rather than having to travel back and forth between meeting rooms. But at the same token, you're online, and we found that folks are very much more productive as they went from day to day because you didn't have that lag time in between meetings. The one issue is you get to a point of hyper productivity in terms of you're working long hours, that you have to learn to kind of step back a little bit and give folks a little bit of a break because you're scheduling so many meetings along the way. But the interactions I found has gotten more personable. One of the things that we've done organizationally as an IT leadership team, our CIO, as well as many members of his leadership team as well, we meet once a month with our entire IT organization, and we have an IT town hall. And whereas in the past, we would have to pull people together in a group, have a conversation, they were across a diverse geography throughout Pennsylvania, whereas now we can coordinate these meetings. We've had them once a month, and essentially it created a sense of communication that was unseen before. So between all of the technologies that are in place and the ability to be able to talk to each other and see each other, I think it makes us closer. I really do. It brings us closer together.
Paul, is that reflected in your experience as well?
Yes, I think both the use of Zoom and Microsoft Teams, same exact thing, and also the exponential rise in the telehealth and the speed by which we could do it, parallel stories.
So, Bill, you talked a little bit about some of the lessons you heard over and over again. What lessons stood out to you as the most important?
One lesson I found to be probably most important, and that popped up a number of times actually, was the importance of IT teams working with physicians who would be using these technologies and quick fixes. The CIOs were saying that the help of the doctors was incalculable in quickly standing up IT solutions. For example, Jason Cherry, Director of Information Systems Technology Services at Lexington Medical Center in South Carolina, said the lessons he and his team learned when rapidly prototyping their telehealth solution were very important. And one reason that Lexington's integrated video visit succeeded was that the IT team had excellent feedback from several physicians before the team finalized the product. Here is just a brief quote from Cherry. Quote, "We presented them with a solution that was about 80% complete and did the primary functions they expected. We explained that this solution wasn't a finished product, and we really needed their input as part of a pilot offering. This process made some of the team nervous because they felt as if we were releasing an inferior product to our customers. But the feedback from the doctors allowed us to quickly fine-tune the remaining 20%. And another lesson that stood out to me as quite an important one was actually one that Paul brought up. Paul said that a greater number of patients needing high care intensity with less caregiver interaction is clearly not a recipe for success. And that led to repurposing existing technologies and reimagining what could be done with various types of IT. So, Paul, maybe can you talk about that lesson learned a little bit?
Sure. So I think that, to the earlier point about what allowed scale and speed was really a singular focus of there's no competing priorities, in any organization or any hospital or any business, everyone has a different priority of what they think is the first priority to do. And as a result, I think a lot of innovation or innovative solutions stall as a result of just misalignment or the need to align on a priority. And with COVID, one of the silver linings was that was everyone's priority. And so I think we were able to scale very fast because, at a hospital for special surgery, we're an orthopedic hospital. We had one weekend where we were going to be a COVID hospital and take COVID patients to do our part to help the city of New York sort of in one weekend. And so that was the priority. There was no competing priority. Everyone had the same goal of that. And as a result, the example you just gave of the physicians and the clinician and IT working together, I think it just comes down to alignment. And actually the struggle now is keeping that same alignment for all of, in a post-COVID world, I think is another type of struggle that perhaps is more of a struggle now than it was at the start of the pandemic. So I think that's sort of broadly why I think we were able to scale and achieve goals quickly, is just that we were all aligned. In terms of the innovation and the different solutions, we aren't able to. What I said in the article was that it wasn't enough to just implement technology that takes the old paradigm and make it remote. We had a new paradigm of sicker people, sicker patients with the need for less caregiver interaction, because exposure time at the onset of the pandemic, people weren't sure how much time could be spent in rooms, but still needing to ensure the same level of safety. And so I think the coupling of those two things just naturally led itself to the need for telehealth and remote patient monitoring and all these things that are happening now.
One more question for you, Bill. What did you hear that you didn't expect as you went and spoke to all these different folks about what they learned from COVID-19?
One of the most unexpected lessons learned also came from Paul. Paul brought up human resource information systems, which, as he said, is not typically what comes to mind when those within the healthcare industry discuss what IT solutions are paramount to ensure optimal patient care. Advancements in areas with direct impact to patient care, such as remote patient monitoring, telehealth, and AI and machine learning, get much of the attention. But Paul noted that the pandemic has shown that without those on the front line caring for patients is not possible. Therefore, a system that shows who those staff members are is a basic requirement, though it is often overlooked. So Paul, I was wondering maybe if you can dive into this human resources IT lesson that you learned during the pandemic.
Sure. So I oversee clinical informatics as the CNIO, but I'm also responsible for occupational health. So I have a unique lens into both of these areas, and both of those skill sets sort of converged nicely, though it was a lot of work, but nicely in order to do my part to help the organization. So, I think for an HRIS system, it lives in a centralized database, typically the one that pays the staff. Is everyone has our HRIS system that's used for payroll, and that's accurate. everywhere because it has to be, or people wouldn't get paid. And so everyone knows who's working there. But really, to have bidirectional interfaces between HRIS payroll systems and every other system that has employee data, be that the organizational learning system, the employee EHR, the electronic health record where the employee data is stored, and also RTLS systems if they're deployed at hospitals to know where and when employees go and to where they go. I think those interfaces they don't always exist, or they're not always kept current in real time. And so 2 examples where that was necessary for the pandemic that they were is in contact tracing, or the ability to know who's going into rooms and who interacted with patients and whether or not they may have been exposed to COVID, and to have that be an automated process as opposed to a manual, interviewing on the phone process. And the second now is vaccination status reporting of who's received the vaccine, who works at the organization, and who receives the vaccine. So I think, it's not logistically difficult to do in terms of an IT. It's just a bidirectional interface with a feed or an API that goes between all of these systems. But I think to take note in every organization of all of those systems, I think if an organization looked at it, they may be surprised at how many systems store data about their employees, and if they truly have an interface to all of the other systems. And that need is always there for operational efficiency and safety, but I think it's just brought more to the forefront now.
Yeah, and I would have to concur with that as well too, because it's something that, when you look at this and you're thinking about the pandemic as a whole, I think organizationally it brings a lot of those areas out that really you don't normally see in the day-to-day because it's always operating. But HRIS is a critical aspect of it, and one of those things is really surveying the employees as they show up on campus. How do you integrate that to your team and make sure that they're being treated and cared for as well, to make sure that they're not impacted. So I think you make a great point on that front.
Yeah, I heard definitely a theme between some of your answers, Paul, and some of yours, Joe, about just, it seems like a lot of times people don't focus on the internal efforts at the hospital that keep everyone talking to each other and things running smoothly. We think a lot about the way we're using technologies to connect clinicians to patients, but whether it's those online meetings for the team to work together, or the HRIT system to keep track of everyone inside, there's a lot to this idea of like internal workforce management.
Exactly. And one of the key things there is you want to think about is that your leadership needs to help the organization break down those barriers, drive that change. As Bill stated earlier, we're a physician-led organization, and at the same time, as we look at this, everybody from our CEO on down met on a nightly basis, several times a day, driving that change, looking to ways to be innovative along the way, and try to make sure that everybody's comfortable from that aspect. And it was pretty amazing when you see all the technologies that are in place, the innovation that actually happens at the individual parts of the departments of the organization. And in the ICU, they're able to take some of the existing technologies and be able to put them together into a cart that allowed them to care for the patients in a more safe and really helpful environment for the patient as well. So it's a really nice thing that we can look at, that the team, the employees, not only the physicians, but the nurses, everybody come together and really make the difference.
Paul, I was reading through, Bill's stories that featured both of you before the interview. And one thing that struck me was this idea of comfortable versus uncomfortable innovation, and innovation that really pushes people outside their comfort zone. It's not just an incremental improvement in what you're used to, but goes beyond that. I was wondering if you could talk a little more about that too.
Sure. So yeah, in the article, I think I mentioned that there's this great vulnerability to be lying alone in a hospital bed, and so on one hand, repurposing existing technology for the use case of patient care might not seem that it's enough, because for something that great, where you have something so serious as a sick person in a bed or a patient, it would seem that we would need to deliberately conceptualize and create innovation novel for that specific, vulnerability. But it's sort of a paradox, because if we double down and just look within healthcare, we may not have much might not have much to find, as much to find as if we look to other industries. But I think, comfortable would be taking the innovation of the other industries that have perhaps gone farther down the use of AI and robotics, machine learning, computer vision. There's some industries that are more advanced than healthcare currently in that way. And so if we take those solutions and we apply them to healthcare, we could just say, Yahoo, we did it, and that would be comfortable innovation. I think, not being comfortable is to take that technology and then combine it with the reality that this is a more complex industry, that there is a sick patient in the bed, and really use those tools from other industries and the lessons learned there, but to really realize that we need to do more for the patient if those tools are to succeed in this complex environment.
For my last question, I'll open it up to both of you, but I can't resist the opportunity to ask sort of one of the big questions we've been grappling with, which is really about now that things are starting to return to normal. And Joe, you mentioned this big telehealth boom that you saw as the pandemic started. How much are we seeing that as being retained and being the new normal? How much are we receding a little bit now that it's easier for people to come in person? And where do you guys think that's going to shake out in terms of the balance between telehealth utilization and brick and mortar visits?
Yeah, that's a great question. I think, as you saw through the pandemic, you did see a great boom in terms of telehealth visits and how it goes forward. But and you'll also see some tapering in terms of, as we get back to a normal business, there are services that we did hold up because we couldn't do them at the time internally. So you're going to see that shift go back a little bit. But I think the lessons that we learned along the way, and one of the examples I gave is like when in the articles, I had carpal tunnel surgery. And I met with my physician. Went and had the surgery, but all my visits were e-visits. And that's something from the standpoint of a patient satisfaction standpoint, that's a huge deal. If I don't have to leave work at a given day to go in and see a physician, I could just pull them up on my computer and I could show him my hands and say, here we go. This is what's happening. Essentially we can, really see the efficiencies that healthcare could truly gain. So I think you'll see a tapering, but I also think you're going to see that the market is going to be embedded for a long time to come, most especially from a work from home standpoint. We found that folks that they're working from home, they want to keep working from home and they're more productive in that light. You'll have some folks come back, and that's important because you do want to have that person-to-person communication. But I think the changes are it's going to stabilize a little bit, but I think it's here for a long time to come.
Yeah, I agree with Joe in terms of the boom and then a little bit of a taper, but much of it remaining. And I think this, alludes to what I was saying a little bit earlier. When both with telehealth and work from home, there wasn't necessarily a choice. It was that, or we don't deliver care, or we don't work. And so I think now we have to have a thoughtful discussion or deliberation within our organization and within our society over what is optimal to be done in person versus what is optimal to be done in home. Certainly some roles in the healthcare and also the global job market can be done from home. And some telehealth visits can be too. The examples Joe gave of follow-up visits are perfect. To say all things will be telehealth, that's not what Joe was saying either. I know he wasn't, but just to call it out again, there are certain visits and appointment types that probably aren't optimal for telehealth. And that's where I think it's actually harder now, because again, when it was kind of an all or nothing or a big bang, we must do this and everyone is aligned, it's easy in a way to just scale with the speed, say everything's this way. But when you get down to the nuance of, well, which appointment should be, which shouldn't be, which role should be work from home, which one shouldn't be, it just becomes much more complex, and that naturally has a slow to the speed at which things can progress. But I do completely agree. I think that they will taper a little bit, but both things have an optimal place, and we just have to find collectively what that is.
Well, any final thoughts from anybody? I do like to give people a chance at the end to give any advice they have to our listeners who are folks working in the healthcare space, much like yourselves.
I would just say that, if we take a look at this, we never want to forget the lessons that we learned here, because I think they're very valuable. And I think it changed the way that we do business to be more of an innovative and to think out of the box. And it challenged our workforce to be able to do that as well too. The other thing is it moved us from our own geographic areas to a global area. Like essentially, we have employees that we're finding staff that we can get from other parts of the country to come work for us in a small middle of Pennsylvania town. That in essence we could we have talent that we could take advantage of, and that's what these changes have done for us as well too. So caring for patients, caring for our employees, caring for our communities has really, I think this has brought us all together in a nice way, but the key is to sustain it in the best way, as Paul had said, in a very measured way.
Yeah, couldn't agree more. I think the only thing I would add probably is another piece is just not to forget what's possible if everyone is aligned. I think that was the silver lining of it, is to just really be part of something, everyone focused on the same goal. And it was remarkable what the whole healthcare industry collectively did together to fight the pandemic. And I think we while it might not be possible every day, just to remember that it is, if we remember to align ourselves and get all the right people in the room to make the decision and move quickly.
Well said. Well, thank you all for joining me. Thank you so much, Bill. We will, of course, include links to the whole series, and particularly up top to the two articles that featured Paul and Joe. So you guys can check it out. Bill does great work over at Healthcare IT News. He does a series of editorial series that go kind of deep on these big questions like, what have we learned? And so I would encourage all of you listeners to give those a read. And thanks again to Zoom for Healthcare, unified communications that keep you connected and compliant. And until next time, keep innovating and keep being healthcare changemakers.